All right, so we're going to go ahead and get started. Good evening, everyone. My name is Benson Commenda. I also serve on the Student Membership and Involvement Committee for ACHE Southeast Texas chapter, and I'll be tonight's events moderator. I would like to welcome you to tonight's session, Healthcare Administration Internship Panel. The evening, we will learn about the organizational benefits interns provide and how to implement a successful internship program within the organization. We would like to thank our chapter strategic partners for their support for this program and our educational events. Our charter member sponsors, Texas Children's Hospital, Houston Methodist, St. Luke's Health, Memorial Hermann Health System, MD Anderson Cancer Center, and HCA Houston. Our diamond sponsors, UTMB Health and the Intercontinental Houston Medical Center. And our platinum sponsors, Abbott Nutrition, Harris Health, Legacy Community Health, Luminaire, Page, Reality Trust Group, Texas A&M University, Texas Women's University, University of Houston Clear Lake, Village Medical, and EEPB, as well as our silver sponsors, Brazos Sports College, Candio Partners, Kindred Healthcare, and the UT School of Public Health. Please note we have several upcoming exciting events of interest, all of which you can register for at www.achetc.org. Register now for this month's Coffee with the Chief on Thursday, February 29th. This free virtual program allows you to get to know a healthcare executive and network with colleagues. Our spring 2024 Board of Governors exam review course has opened up registration as well. So sign up today and move to the next level by achieving your FACHE and becoming board certified in healthcare management. Register or make a tax-deductible donation for our third annual Sporting Clays Tournament and Scholarship Fundraiser on Thursday, March 22nd. This raises funds for our local student scholarship program and allows us to give up to $35,000 to local students in healthcare management fields. We raised almost $20,000 last year. Help us beat that record in 2024. And this is only a small sample of upcoming events in the early spring 2024, with tons more to come. And now I'd like to introduce our panelists that we have today. Starting off, we have Douglas Washington, who works as a quality coordinator at HCA. Next, we have Cindy Shebb, who works at the Harris Center. And then we have Bianca DeSwani, who also works at the Harris Center. And then we have Mariah Yanarella, who works at Texas Children's Hospital. And lastly, we have Dr. Sandra Tyson, who is an assistant professor at Texas Women's University. So starting off, Dr. Tyson, can you please tell us a little bit about, from the educational perspective, on how to implement an internship, a health administrative internship?
All right. Thank you, Benson, and welcome everybody. I appreciate you showing up for this session. Before I get started, I'd like to ask you a question. I want you to vote for me real quick, or raise your hand, rather. Down at the bottom of your Zoom screen, you'll see an option that says reaction. If you click on that, the little bar at the bottom says raise hand. So what I want you to do is, if you are here not as a student, but as somebody who's already working in healthcare and has an interest in potentially taking on interns or an internship program, can you please raise your hand? Okay, it looks like almost everybody here are students. Okay, well, then that helps me know better how to talk about some of these things and things that I want to emphasize for you. There are, internship opportunities, that exist out there already. They're there. A couple of the people who work for a couple of the large healthcare providers with established programs are going to talk to you in a few minutes. But if every student in our healthcare programs wanted to do an intern, there would not be enough internships available, which is one of the reasons we're having this session, is to help those who don't already have an internship program or taking on interns to know a little bit about how they can start doing that. But the other thing, and this is for you students, is I'll have students that'll come to me and say, well, I applied for this one, I didn't get that one. Are there any others out there or whatever? And here is what I always encourage them to do. And it's what I call a design your own internship program. Okay. And what that is where you do a little background work on some organizations, the type of organization that you would like to have a career with. That might be an outpatient practice of some sort, might be a nursing home. It doesn't necessarily have to be a big hospital system, but identify some organizations like that, do a little research on them, find out who works there, what their jobs are, where their jobs might align with the kind of thing you would like to do, and then make contact with that person or that organization and offer yourself as an intern for a semester or a summer or whatever. You can do this. One of the ways you can do it is kind of putting together not a resume, because you're not selling job skills, because you're learning right now, okay? And you're wanting to go into a situation where you're going to learn about what it's like to work in healthcare. So this isn't a resume, but put together a nice little clean one pager that provides a brief introduction of you, what your goals are, what your interest is in their organization, and what you're offering to do for them. And then introduce yourself, send that, follow up with a phone call. I got to tell you, there are tons of people out there working in healthcare. If they had a student come up to them and say, I'll be your intern, they would say, okay, let's do it. Okay. I got to tell you, I had students do that before I started teaching full time. When I was out there in the world practicing, I would have students coming up to say, can I work with you? I want to get some experience in this area. And I'd say, yeah, come on. And I would take on 2 or 3 interns every semester. And I liked it when students took that initiative and they approached me and said, this is what you're doing, and I'm interested in learning about that. And I can tell you, you will impress people when you do that. And who knows, they might be your future employer. So I would encourage you to think about that and consider doing that if there's not, seems to be an internship out there available for you. They are very competitive, especially at some of the larger institutions that are very established. So there's other ways to do that. And in the medical center, it's both a big world, but it's also a small world. And if you know anybody, they can refer you to somebody else, but you be talking about it, introducing yourself to people, talking about it. And at some point, you're going to hit the right person at the right time, at the right place, and you'll be able to put together your own internship program. So as far as designing an internship program versus, say, just taking on a one-off or whatever, you can take on 1 or 2 interns and not develop a full program, such as what Ms. Dewani and Ms. Yanarella are going to talk about. They have very well-defined, fully developed programs. But if you're working in healthcare somewhere, you don't have to have a fully defined program to get started. What you need to do is reach out to one of the universities or more than one university and tell them you're interested on taking on 1 or 2 interns. And then they will actually lead you through that process. That's exactly what I do for TWU. I have people sometimes contact me. Sometimes I'm going out and contacting others. But But what I do is I usher them through the process of getting that set up to start with your first one or two. Um, it typically involves just understanding what the expectations are on either side and having what we call an affiliation agreement in place. That is, and TWU has their own affiliation agreement template for this kind of thing that we use with organizations. And so we send you that template, and then whoever the signatory is for your organization, whoever the responsible party is for contracts, will look over it, make sure that it works for your organization. There's nothing in there that you can't abide by. And if there is something you need to make an adjustment on, all you have to do is contact me again, and I work with our law department and work with you, and then we eventually are able to reach an agreement. And then once that is signed, then we're off and running. But one of the things that's important to know is that the intern that comes to your place of work is going to bring certain things, and they're going to come to pick up certain things. Okay, so they're going to bring the knowledge and expertise that they're gaining in their studies. Some of them may have a little bit of work background, some of them may not. But they're bringing some, especially some unpracticed expertise. And it may be in an area that you would like to explore more in your organization. Perhaps you're interested in doing some sort of performance or quality project. You could take on an intern that's had that course, and then they can help you develop that project. And if you keep them on long enough, they might be able to help you carry out the project and so forth. So they can bring a lot and fill in gaps for you. On the other hand, they will be lacking a great deal of experience. They're not going to be walking it. Somebody that's got a lot of experience in healthcare doesn't need an internship. Okay. The whole reason to have an internship is for that student to start learning the culture of healthcare, of the sector that they're going into. Each sector in our society has its own culture, and each organization within that sector has its own culture. We have our own language. If you've ever gone into a new workplace, one of the things that probably hit you was all the acronyms and shortened words that they use for things, and you're like, okay, what's a CNA? What's an ACO? What's a so you don't know what all those acronyms meant because that's their language. Okay. And so just the act of a student working in that environment is going to start learning the language of healthcare. And that is one of the huge benefits of an internship, is learning the language of healthcare and understanding how things work. And the other thing is, the uniqueness of the healthcare sector is unlike any other, because any other organization, they're producing services and products, but their services and products rarely ever deal with daily morbidity and mortality, life and death every day. Their customers that are coming in are not coming in on the worst day of their life and getting bad news. So everybody that is in healthcare has to, regardless of whether you're delivering patient care or not, has to be acutely aware of the fact that their customers are not in good shape. They're there because they're not in good shape. And we have to give them a much wider berth than we would, say, anywhere else. Not that good customer service isn't what you should do no matter where you're at, but I'm just saying it's especially important in our industry. So, and so what I was talking about is a student coming in and bringing some new skills to your workplace, whatever, and picking up things. Yes, of course, they can do jobs that and do some activities that are not necessarily the greatest things in the world. They might have to go make some coffees or I mean copies, or they might have to go deliver some coffees now and then, but that should not be the extent of what they do. That you see cartoons and you see television shows where interns are treated really badly and all they do is get coffee and make copies. Well, that really is not the truth of how it should be, and that may happen in some industries, but we try to make sure that doesn't happen in healthcare. And that, like I said, it's not to say they can't do some of that because they should, but they also need to be involved in some more important tasks and sitting in meetings and understanding the interactions of interdisciplinary teams and things like that, because that's a very important part of healthcare is interdisciplinary teamwork. So, so anyway, so that is to say that while an intern can bring some really specialized skills or even a broad range of skills and really be an asset to your organization in various different ways, they're also coming to learn, and you have to respect that, and you have to provide that opportunity for them to learn and grow. And you do need to keep in mind the level at which that student is at in their academic and career, because if somebody is an undergraduate, you can't expect them to perform at a master's level. Uh, so you need to keep those things in mind. Um, what else? Um, do I need to tell you that's really important? Okay, so uh, the affiliation agreement is really important because that has to be there before we can place somebody there, or you can hire somebody there. Now, some internships are paid internships. I will tell you, most of them are not. Internships are typically not paid because they are trading their labor for the experience and the training. And so you're providing the experience and training, and they're providing you some labor. Um, some you can provide a stipend, you can provide a small amount of pay if you want, but that is something that you determine on your side, um, and have to work those details out because the university will not be involved in any transfer of funds or anything like that. So that's strictly between you and the student. When students get it paid when they're very lucky, because those are few and far between, but most students know that not to expect payment. And I will tell you, students, that if you're doing the design my own internship route, you can't go there expecting them to pay. You're going there to offer your services. Okay, so just keep that in mind. But that's okay. That may be a good trade-off for getting to design your own and go work exactly where you want to work, doing what you want to do with whoever you want to do it. So, so there's trade-offs for that. So throughout the time period that the person is performing their internship, they will be mentored by someone in their university. So somebody on the university end will be keeping tabs on them. They will not be coming to the organization's site unless there's a specific reason for them to. For example, Harris County Public Health, they have hosted a lot of interns in the past, and what they would do is at the end of every semester, all of their interns had to do a poster presentation, and they were set up in this one big room. And so those of us on the university end would be invited to come and see what they did and everything. And so there's various organizations that do that kind of thing. So there may be a reason, but the university doesn't necessarily go on site for anything unless a specific reason. But we are monitoring, we are to stay in touch with the student. We're trying to make sure that we help the organization if any problem arise, figuring out how to deal with it, how to make sure that that we a lot of times issues can arise just simply out of not knowing something, or pressure, outside pressures or whatever. And so if the site contacts us, we will work with the site and the student to resolve the issue, because we want it all to be successful for everybody. We want the site to be glad that they posted an intern. We want the intern to be glad that they did the internship, and everybody gets something out of the deal. Okay, what else? At the end, typically what happens, well, one of the things that I will tell you that we did from our side, and I'm sure other universities do something similar, is we do track the number of hours, because in order for the student to get academic credit for the internship, they have to put in a certain minimum number of contact hours with the organization. And so we do track that. And so the preceptor is a person at the organization who is providing the supervision of the intern while they're at the site organization. And that preceptor will be sent an evaluation, a link for an evaluation, and they will complete an evaluation at the end. Our program, we have students write a report at the end where they describe what they've done and how they may or may not have accomplished the competencies they were trying to accomplish, and what have you. So we have our students do that. Now, those kind of things may vary within the different university, but there's something going on at every university where there's a tracking of the student during the process. Okay, well, I guess the final thing I want to say before Vincent asks me any questions is directed specifically to students, and that is, if you get an opportunity at an internship, that is a big deal. It is an important thing to do for your career for a number of reasons. You have the opportunity to go in there and demonstrate for that employer, possible employer, what you're able to do and what you bring to the table. And when you're going for your interview, you should be going there, you should be dressed professionally. You should be acting like a job interview, because it basically is, even though you're not getting paid. And you should be ready to put your best foot forward. And you put that best foot forward throughout the entire internship. Don't let off the pedal just because you're getting near the end. Sometimes the most important thing that you can do is not how you start, but how you finish. You want to finish strong. Okay. And I guess that's my last thing, other than Mark is actually going to attach a file we put together that's called a resource packet. And what it has in it, it has documents from 4 different universities in this area: TWU being one, Park University, Texas A&M, and University of Houston Clear Lake. Have put documents in there that give you a little information about their internship program. So take advantage of that. Those of you who are students that may be trying to design your own internship program, you can look at this and kind of see the kind of stuff that is done with different universities. And so you can kind of have an idea when you go approach somebody and they start asking you questions, then you will have some resources you can use to answer those questions. For example, if you are a TWU student and you go approach somebody, what's in this packet is our affiliation agreement. That's one of the things in the packet is our affiliation agreement template. So if you print that template out, you can take that with you, and when you talk to them, if they say, "Okay, I'm gonna," then you can hand it to them. And they can get started on the contract right away. Okay. So anyway, so those are some resources for you. We are currently working on a guidebook. We're not quite ready to share that with you yet, but we will in the future. We'll share that with the membership. And so I guess I'm going to shut it down. I may have used up all my time. I think I did. But is there anything, I guess, important that those of you who are attending would like to ask before I finish up my last few minutes? Any questions?
Hi, I have a question. How I wanted advice on how to go about asking a preceptor on maybe being stipend or paid for. Just because I know it could kind of be nerve-wracking to kind of approach them and ask them for a paid internship or even for a stipend.
Yeah, that is a very touchy thing because they are actually giving you free training. Okay. So asking them to pay you to train you is a little bit of a touchy subject. And if you're somebody that if you have to work and be paid and can't put in that many hours in a free internship, then if I was going to do it, and personally I wouldn't, but if I was going to, I would be very careful and I would approach it along the lines of, is there any way I could possibly get a stipend for the work I'm doing here? And just, throw it out there as just an idea, but you're not counting on it. Yeah, because if you're approaching them, you're asking them to train you. Okay. And that will take time on the part of their employees, particularly on the part of the preceptor, who's going to have to invest their time in training you. Okay. Another question? Oh, Shilpa?
Hi, Dr. Tyson.
Hi.
So how would you do an internship if you're working full time? Or is that
Well,
even a possibility?
Well, it is possible, but it's really hard. And I will tell you, there's a couple of ways, maybe about 3 ways that I can think of. One of them is, and I know nobody ever wants to do that, is to maybe finding an intensive internship where you get all your hours done within a few weeks and you take off from your full-time job for vacation or whatever and you do your internship. That's one way. Another way is to do it during the hours that you're not working in your regular job. And of course, you can't put in as many hours when you're still working full time. So that internship may occur over a longer period of time to accomplish all of those hours. There have been people that have requested being able to do one at their current job, and that is typically not allowed unless the only time that I've ever seen it allowed is a student who was working at a very large health system. They were working at MD Anderson, and they wanted to intern at a completely different department that had nothing to do with their department at all. And they were able to get their bosses okay to take those hours off and go spend it elsewhere. That is rare. That is very rare. I'm not going to say it's impossible because I've seen it happen, but that would be another way. But if you're going to do it in your own organization, it's got to be an organization that's so big that you can do it in another department and not bump into your old job. Because that's the point of an internship, is learning something new. Catherine?
Hello. Yes, I would like to ask if a student has never gotten an internship before, and if so, what did they do about it?
Oh yeah, there's plenty of interns that have never done one before. sometimes interns do more than one, actually.
Uh,
But
I
what
meant that that the intern or the student has, like, they're not able to get one for whatever reason,
well,
like whether they were rejected for.
well, that's why I'm saying that's why I recommend doing the make your own or design your own internship. And you can do this. I would start with a smaller organization, maybe an urgent care center or a multi-specialty outpatient center, or a nursing home, or something where those folks are always needing extra help. Always. If you walk in their doors and say, I'm here to offer you free labor if you'll let me intern here, they will most likely take you up on that. Okay. To follow the steps that I just recommended to you, put together the little one pager that kind of introduces you, what your goals are, what you want to do for them, why you want to do it, what you expect to get out of it. And then go introduce yourself and ask for an internship there. I'm telling you, Pete, if you do that, you're going to eventually find somebody that says, yes, when can we start doing this? They will. Is that helpful, Catherine?
Yes, thank you.
You're welcome. All right, Benson, I'll turn it over to you. I'm out of time, so if you want to move on to the next group, feel free to do so.
Yeah, so for the next portion, we're going to talk about building an internship from an organizational perspective. So Bianca, could you please start off this one? How has hosting interns been beneficial for your organization?
Yeah, absolutely. And it's a pleasure to be here, and I'm excited to talk about it. So first and foremost, it allows for a really fresh perspective for the organization. And so, the students are coming in with all of this different knowledge from their respective schools that they've either, learned from their coursework or talked to their professors about, and they bring it to the organization that they're interning at. And that's really valuable for us as, the agency. That way we can see what the new and improved kind of topics are that these students are learning. Another thing is that it fills vacancies for us, right? I mean, if you look at your HR classes, you can see that we're always trying to fill vacancies, and that just is a fancy word or a fancy term for saying that we use the internship as a pipeline program to fill jobs. And then kind of another thing that's kind of a benefit to us is that aside from the students learning, the preceptors are able to learn from the students as well, and it's really fulfilling for us.
Mariah, would you like to add any points to that?
I think Bianca did a great job kind of summarizing what it means for us on our side. From an organizational perspective as well, for some of our leaders, it is a really good relief to have workers who come in who are ready to take things off their plate that maybe they've had for a while and just haven't had the bandwidth to get to. So that's always exciting, as well as leaders who are chomping at the bit to have new people step in and help out.
Right. So Bianca, I know the Harris Center is very new with implementing the healthcare administrative internship. So, and I know you were very very part of setting that up. So, can you please tell us a little bit about the specifics that you have to do within your organization in order to get that program set up, which includes approvals, buy-ins, policies, and things of that nature?
Yeah, absolutely. It includes all of the above. So personally, when I was in school, I did a bunch of internships, and Dr. Tyson can kind of attest to this. But instead of, kind of going the full-time job route, I tried to maximize the experience that I was getting in a very short amount of time by doing multiple internships at once. And so, sometimes that might not be the best route for everybody. I was able to manage it and really learn from it. And so, using that knowledge of, what I really liked and what I really benefited from as a student, and what I, kind of left alone, I took that information and built my own internship program from that. And so, you know, kind of in order to make it a bit more succinct, I put it on a PowerPoint presentation, very simple PowerPoint presentation in order to hopefully get buy-in from, you know, those above me. And so, you know, after talking to a couple of different people and kind of going through this J.K. Rowling moment where, you know, you get a bunch of no's, but you finally get that yes. You know, I was able to get that buy-in and kind of really outline what I thought the best route for kind of an internship program at my organization at the Harris Center would look like. And so, you know, using that to kind of operationalize, you know, the outline is kind of that next step. And I'm sure that we'll talk about that later on in this panel. But, you know, it really makes, you really have to make sure that, you know, the buy-in is there, the affiliation agreements that you have are there, making sure that you, you know, talk to the kind of internship coordinator at those different schools that you have that affiliation or those affiliations with, from an organizational perspective, in order to make sure that you're covered when taking on these students is really important. And then kind of going from there to, you know, bolster your recruiting efforts and whatever else the case may be.
All right. So when you talk, you kind of talked a little bit about the affiliation agreements with educational institutions. Can you guys kind of let us know a little bit of who reaches out to who first in order to establish that relationship between the school and the organization? Mariah, could you start us off?
Absolutely. So we don't go into affiliation agreements until we select our interns, extend those offers, and those offers are accepted. So once the offers are accepted, we verify if we have an existing affiliation agreement on file with the university. Sometimes they have to be renewed after a certain amount of time. And so if it's expired at that point, then we will go down that route. But usually we are the ones who reach out to the organization. And by we, that's actually our HR and legal team. So we give them a heads up. We ask them to verify if this organization has an affiliation agreement on file. If they do not, we begin that process and we reach out to the university and make sure that we have everything we need and that we're squared away. But if we do have it, we just ensure that it is still current. And if it is, then that student is good to go and is covered under the existing agreement.
Yeah, and if I could just add to kind of level set expectations for everybody on the call, that's not necessarily across the board. And so I'm sure Mariah can kind of speak to this too, but you know, this is kind of a, I guess, Texas Children's kind of thing at the Harris Center. We make sure that an affiliation agreement is already in place with the school before we decide to take on the intern. And so that, for us, for the Harris Center, has provided to me a more seamless process. Again, everybody's different, but just kind of level setting those expectations.
So when it comes to, Mariah, you had mentioned that like these affiliation agreements can expire. Over reaching an educational agreement.
Vincent, you're cutting in and out on me there. So go ahead and ask that question one more time if you don't mind.
These affiliation agreements can expire. And to me, that kind of brings up like a hurdle whenever you're trying to bring on an intern.
He's breaking up, but
establishing an educational agreement.
You were breaking up again, Benson, but what I'm kind of gathering from what little bits I'm hearing is, and I think I might can address this, is, you know, some affiliation agreements are what we call evergreen. What that means is the language in them says that they are in effect until one of us decides we don't want to do it anymore. We give the other one written notice, and then 30 days later, it no longer is in effect. But there are other agreements that have time limits on them. They might be good for a year or 5 years or 10 years, whatever. So it just depends on the agreement itself.
Mm-hmm. And so can you also explain the importance of having an educational agreement for the organization and the educational institution?
So formerly in our internship program, the interns were unpaid, which is why that affiliation agreement was so important. It covered the student from both sides, from the school side and from the organizational side. Texas Children's actually newly this summer is offering our internship as a paid opportunity. So now that it is a paid opportunity, the affiliation agreement is not as in, I don't want to say it's not as important, but it's not quite at the forefront since students will be completing traditional HR paperwork to join our team and work with us. So it's going to change into a little bit of a different season because this is our first semester doing it. We aren't sure what that looks like yet and what our expectations are from HR when we start extending offers, if affiliation agreements will need to still be in place. Our inclination is they probably won't need to be, since our paperwork will cover that student. But again, it's different with every organization. Sometimes we like to have them just to be safe. And so the university is aware that we are interacting with their students and offering them this opportunity.
Okay. All right. So you had mentioned that summer internships are approaching. So once or whenever an intern starts his internship, how does the organization ensure a meaningful and educational experience for the intern? Bianca, could you start us off on this one?
Oh, sure, absolutely. So I think, the first move that we make is making sure that we have a meaningful orientation process for the student. And so that really allows for the student to understand what the organization is about, what we're going to offer, what we currently offer, and kind of a rundown of what the internship um, will look like for the semester or however long. For us, it's a semester based program. And so, aside from hosting that orientation where we are allowing for even the CEO to come in and greet, our interns, we are also providing for a professional development series. And so what that looks like is, different workshops, educational events, networking events, etc., for interns to learn from. And so this is something that I'm really excited about, because it has brought about a fruitful experience for the intern, so that, not only are they learning from the unit and everything that their preceptor has to offer, but they're also they're also learning from, different professional development types of roles and types of workshops.
I'll just add too, I know this is more on the organizational side than it is on the student side, but the level of planning and the level of kind of organization and preparedness that we have to go through to make sure that we are ready for interns, and that we have, for ours, summer is a 10-week program, that we have truly 10 weeks of content to share, and there isn't really much downtime, is really important as well. So in the preparation process, again, we have a course curriculum that we maintain, that we ensure is buttoned up and ready to go ahead of time. And then during those 10 weeks, it's not really an autopilot type of situation. There is truly a lot of management that goes into making sure that everyone is on task, that everyone has a task, and that their time is well utilized. And so keeping a pulse on that is important. But overall, I can't emphasize enough the planning aspect, but also the kind of the organization that goes into it ahead of time, to make sure that there is a structure to the program, and that it is pretty consistent.
Yeah, that's actually very well said, and I completely agree with that. Another thing that I'd like to add is, kind of having, especially for those looking to establish internship positions of their own, to make sure that there's regular pulse points, regular checkpoints, with your preceptor, or, in that case, with your student, and vice versa, just to make sure that everybody is on track, that the learning outcomes are being achieved. If not, why? And kind of tackling those as well.
So when it comes to planning, like for each semester for an internship, what's the biggest obstacle that you face in the process of uh, offering internships?
So I think initially oh, go ahead.
Oh, you
I
can go
don't,
ahead.
it just keeps kicking me out. So I have to keep jumping in. I'm
Oh,
sorry.
it's okay.
Yeah, so I'll tackle this question and then Mariah, you can jump in whenever you can. But initially for us, it was the buy-in was the biggest obstacle, just because it was a very new position. Nobody in the agency really thought about having an administrative internship position before. There wasn't necessarily that value that they saw, and so it was really upon myself to kind of show them the value and show them, what the Harris Center could look like with administrative interns, kind of supporting them and, kind of us growing the interns and kind of vice versa. And so that was that value proposition slash buy-in. That was the heavy lift. And then so now, kind of alluding to what Mariah said beforehand, it's that constant maintenance and the constant check-in. And so that's kind of the heavy lift at this point.
I think I picked up the question from the context. My audio cut out right at the end of the last one. So for us, the biggest obstacle this go around, now that we are paid, that is very, very different for us. So it is understanding kind of the legal bounds of a paid internship, understanding that these are temporary employees. We know you're only going to be with us for 10 weeks, understanding kind of the hourly rate that is a fair market value for this type of experience. Making sure that we have the budget aligned for that, making sure that our organizational partners are aware of that and that they are also supportive of it, as well as kind of renegotiating how many positions we have for that. Understanding that, previously we took 3 interns with the understanding that they were unpaid because that's what we were comfortable managing to give the best experience. And now that they are paid, we had to fight for those 3 to make sure that we secured spots for paid spots for all 3 of them. And so I think the buy-in can't be understated enough. It is, like Bianca said, a very big piece of it, because people, you can tell them all day long that that's a great idea and that it'll bring value to the organization, but until they give you a chance to prove that, it's just talk.
All right. So switching gears a little bit, we're gonna ask some of the interns that we have on the panel about their experiences with their internships. So Cindy, could you please tell us a little bit of the type of activities that you performed at the Harris Center?
So my semester at the Harris Center was pretty unique because my preceptor was the director of emergency services and residential programs. So about a month into my internship, we had an audit from the Texas Health and Human Services for their residential detox program. So some activities that I did were creating a binder of the materials needed for future audits. So that's all the paper materials that they would need, such as the emergency preparedness plans, employee credentials, and menus approved by the dietitians. And I also compiled health resources for client education that meant specific TAC codes, which is the Texas Administrative Codes. And then I also reached out to local organizations to see if they had materials that they can donate to our clients, because a majority of them were homeless. So we were looking for any food resources or any clothing resources that they can provide for us.
Douglas, would you like to put your input on this as well?
Of course. So just a little bit more of a background for myself. I actually created my own internship for those who have asked. It was actually through ACHE. I did the mentorship with Elias Mendez, the COO over here at HCA Clear Lake. And then it slowly became an internship just because I put my best foot forward and just presented myself in areas that I was interested in, which was HR and quality. So I had time to spend at both locations and end up getting hired within the quality department through a vacancy. So again, that pipeline can exist for many of y'all. But some of the activities I did throughout the internship was shadowing leaders and being there in the meetings, planning sessions. We're up there with a joint commission accreditation at that time. So we were getting prepared for that. So I had a lot of involvement with, again, printing out papers. It might seem some of that seem tedious, but just looking at the opportunities that's really being presented and learning how joint commission operates, what are some of the EPs, some of these standards that many hospitals have to abide by. And then also, the opportunity there to participate in low-hanging fruits, actually doing some of the small audits and some of the smaller action items. And I even was handed a project, just over lost belongings, right? Just kind of tracking lost belongings across the hospital and see how much we were really spending on a yearly basis in terms of reimbursing patients regarding their lost belongings. So definitely various different activities. And then I can also touch upon some of the HR stuff, looking through evaluations because they recently went through evaluations and kind of that process there. And, some of it is confidential, so you may not get to participate in every single activity that goes on, but definitely during your time there, spent a lot of time asking questions and trying to be as involved as I can. So.
So Douglas, you spoke a lot about a lot of the work you did within this organization. How did this internship impact your skills and competencies related to healthcare administration?
Yes, so it really did reduce the learning curve, right? Based upon my studies, I was able to really take what I've learned, both hard skills and soft skills, and apply it within an actual workplace and see how that application is. And it allowed me to also become very confident. I'm fairly new to the healthcare industry, never previously worked in the healthcare industry before, but it really did open an eye to what's to expect when working in the healthcare industry overall. And it really did kind of change my thought process and kind of remove a lot of the barriers and the ambiguity that really comes with oh, this is how it is, or this is how it should be inside your head. So.
Cindy, this one. What level?
Sorry, I think you cut off. What was the question again?
Oh, oh, it was what level of support and guidance did you require from your healthcare organization during your internship?
Okay, great. So I actually had 2 internship experiences. The first one was the first one was kind of hands-off. I didn't really have a preceptor. I met with the program director about once a week in small groups, and I was able to learn a lot on my own by myself with that. So I learned a lot about like case management, and then I also took part in recruiting for the next internship cycle. But with my internship with the Harris Center is very hands-on. So I saw my preceptor about twice a week, and I was able to shadow her in meetings and then travel to the different sites that she was in charge with. So I learned a lot with my first experience, but I definitely prefer a more hands-on experience. So I would definitely say the level of support that I needed was very hands-on, got to be like boots on the ground, seeing everything in action, and being in those meetings with those leaders and just seeing how the organization operates.
And yes, just to chime in onto that as well, some of the guidance that I had throughout my internship, since I also did work full time as well, and I was only able there to be on my 2 off days throughout the week. As again, it was kind of almost a course over the whole entire mentorship for about a year. Some of the guidance that I had was one-on-one talks with many of the leaders. So, mainly the C-suite executives, and also with other departmental leaders as well. And, as I continue to work, they were able to provide a lot of general education, how-to moments, and sort of the tips and tricks of the trade to how to go about conducting yourself and just being a real asset to the team overall. So definitely some gaps, but they were really able to fill those gaps as well. As long as you ask, they're able to be there to support you.
Right. So Cindy, you had talked about having a very hands-on approach in your internship. Did any aspects of this that you find particularly beneficial to yourself?
I think definitely seeing my preceptor in person a couple times a week, being able to really shadow her in meetings and then having her tell me why it was important. Like, why is it important that we have meetings with different departments? Why is it important that we're having this meeting with like architectures when they're redesigning a new clinic? Being able to really put myself in that environment and really being able to see her staff interact with each other, having me see like what type of leader she is, and then being able to see the clients that we help serve at the Harris Center and being able to really interact with them. So very hands-on.
I'm very sorry, my thing cut out. But Douglas, would you like to add to that?
Absolutely. So honestly, again, it's going back to learning about the inner workings of the healthcare industry that I wasn't previously familiar with. So we're getting that real exposure to all the various different departments. A lot of them were very kind to walk me saying, well, this is our surgical services. This is kind of a brief overview of what they do. Here's a little bit of our financing department. Here's, HR, some of our nursing leaders as well, and kind of what they do. And I spent a lot of time just having these one-on-one talks with each of these individuals and just really picking their brain to, what they kind of do on the day-to-day basis. And honestly, just kind of always, putting myself out there as well. And again, it's vastly different if you work in a different sector, coming from customer service, from retail service, and it's vastly different from healthcare, though that we both provide customer service overall. The way these two operate is completely different. So again, this internship program really allowed me to see that and really prepared me for my current position as well.
So looking back on your internship, could you describe the overall value and impact that the
You cut out again, Benson.
uh, so looking back, could you please give us could you please let us know about the professional development that you really gained from the educational and professional development that you really gained from your internship? and how that really impacted you.
Sure. I'll start off here. So some of the items on my educational and professional development was, again, just kind of taking what I learned and really apply it. So I also did the 4+1 program for my undergraduate. So I was still participating at a graduate level and doing my project management certificate there at Park University, while also attending Brazos Sport College as well. And really seeing like how the studies and the group projects that we did abundance of, and typically, you know, applying it to healthcare and seeing how that, you know, inner workings there at a academic level is also shown there at a workplace. So, and again, in terms of my professional development, it was really able to refine some of my communication skills, my professionalism, because one of the things that they really asked me is like, you know, what can I do to benefit you? And one of the things I was like, I really want to work on, you know, communication was kind of one of them. And they were able to really assist me and give me the project to talk in front of leaders and stuff like that, and made me much more comfortable in terms of my delivery. So these small, minute things definitely do add up. And, you know, participating in this internship just continues to add value, and ultimately, again, just landed me the job as a quality coordinator there. So I was really fortunate to have such an outcome as a result of building my own internship.
Yeah, and then just going off of that, after my internship, I realized that I wanted to develop my skills in project management. So I got my internship the semester before my last year of my program, and I had no idea like what I wanted to do with healthcare administration. Like, I felt like it was like still pretty broad, and I had no idea like what type of like sector I wanted to be in. But working with my preceptor, I realized that I have a passion for projects, and I really wanted to get into that. So right now, my job involves developing a mobile clinic program from the ground up. So the internship really helped me continue my path towards project management.
All right. So, so for our last question, this will be for for Dr. Sandra Tyson. I'm sorry. Can you please explain to us the difference between an internship and a fellowship?
Yes. That is one of the things we very often students kind of get confused about. And that's the difference between an internship and a fellowship. So an internship is typically much shorter, like about a semester or maybe a summer. And it's typically not paid. It's typically done when you are still in class, while you're still in your program before you graduate. A fellowship is something you do after you graduate. It typically lasts a full year, and you are typically paid as an employee. Okay. So one happens before graduation, one happens after, one's short and typically unpaid, one's long and typically paid. So those are the big differences. Fellowships, the competition for fellowships is even much more competitive than internships. And that's because there's fewer of them. And they're typically very deliberate opportunities for the organization to train a new executive without having a commitment to them. 9 times out of 10, they will get a job with them at the end, but because it's a fellowship, they're not committed to it. So that's the big difference. If you are someone that wants to do a fellowship after you graduate, You should be planning for that from the time you start your master's program. You should be doing a number of things throughout that process to prepare you and make you competitive. Those things that make you competitive, other than, you do want to do well on your studies, you do want to make grades. That is important, but that's not enough. That's not sufficient. In addition to making good grades, you need to be getting to know your professors and building relationships with them, and so that they will write you really nice letters of recommendation. You should never ask somebody for a letter of recommendation if you don't know what they're going to write. If you don't know them well enough that you can't be confident they'll write a good letter. Okay. So build that relationship, and you should know whether you can ask that person for a good letter and they'll write you a good letter. Another couple of things, and since you're on an ACHE webinar right now, you're doing one of those things that you need to do. You need to be participating in professional organizations. And that means doing more than just showing up on a webinar. You need to get involved. You need to go to some face-to-face events, serve on a committee, volunteer, do things that have you very involved in professional organizations. An internship, doing an internship is another thing. You do an internship and you can get a good letter of recommendation from that organization. That's helpful. So all of these things and other things, anything you do that supplements just your coursework and that shows initiative and a desire for growth and improvement on your part makes you an attractive candidate. Mark, I don't know if you're available to us right now or not, but you may have some words of wisdom that you can put in here on fellowships.
I believe he had to step out, but I'll go
Yeah, I
ahead
figured
and
he
drop
did.
some. But I'll
Oh,
go
you
ahead
do?
and drop some links.
Oh, okay, good. So Bianca's going to drop some links for us. But one of the things is, if that's what you want to do, prepare for it. Start getting ready. Start doing those things, taking those steps that will get you there and make you competitive. Okay. Another thing, if you don't have good writing skills, get those brush up on those, because you're going to have to write some sort of personal statement at some point. And you want to be able to clearly and concisely tell them who you are, what your goals are, why you do what you do, so forth and so on. But start planning early for the goal of competing for an internship. Now, if you do not get an internship, trust me, getting a job is good. Start looking for jobs before you graduate. If you get a job and get a chance to get into an organization, you get to prove who you are and what you can do, and that can be just as good. So just because you don't get a fellowship doesn't mean that you won't get an opportunity to move up in a healthcare organization and do well. Okay, any questions before you have other questions, Benson?
No, you guys answered all of them really good.
Actually, before we move on to other questions, I'd kind of like to add to the conversation of fellowships that,
Okay.
Yes, I did a fellowship. I did an administrative fellowship personally, but I'd like to also put out the controversial opinion that a fellowship is not an end-all be-all. In graduate school, all you hear is administrative fellowships, and this is really great to do, and all of these kinds of different things. But as I said before, it's not an end-all be-all. I had a mentee in the past who had an administrative fellowship offer in her hand, but then at the same time also had a full-time job available to her as well. And she was very, very conflicted and let me know that, Bianca, I really don't know what to do. And the advice that I gave to her is this: her full-time position was high enough. It was a project management position. And so I kind of told her that, you know, at the end of an administrative fellowship, you're probably going to get a management position anyways. This is you being fast-tracked into a project management position, so you might as well take that. Aside from that, you know, another thing that I told her is that you can make an administrative fellowship type experience in that full-time position. And so what I mean by that is, you know, try to get exposure to different things in that job that you're currently in. Try to connect with people of different departments. Try to connect with people who, you know, you don't necessarily have to interact with on your everyday job, just so that you can get that different experience. You can get that rotational based aspect that an administrative fellowship can provide.
Yep.
And so, you know, it's another consideration to kind of think about.
Yeah, she's absolutely right about that. I have a student right now that graduated last semester. She applied for all of these fellowships. She didn't get any of this fellowship. She was very disappointed. She's like, "What am I doing wrong?" And I was like, "I can't explain it because you are a top-notch student, and I have written you a beautiful letter, and there is no explanation except that there are, you know, a lot of people out there that are very competitive, and it's at the end of the day, there's just not enough to go around. You can have a bunch of really great people, but if you've only got one or two opportunities, well, that means more people don't get them than do. And so she ended, but I told her all along, I said, you do not give up, keep applying for jobs, whatever. Well, she did. She got a great job offer that was probably even better than the the fellowship she was hoping to get. So Bianca is absolutely right. Fellowships are not the be all end all. If you get a job, you've done something. You have that opportunity. But I want to pick up on one thing that I heard Douglas say that I really want to speak to. He mentioned that one of the skills he was trying to develop was the communication aspect. And because he expressed that to them, they set up opportunities for him to get to practice and do that. And that's because he was willing to be vulnerable and say, I'm not very good at this, and I would like to get better. So don't just walk into your internship or your fellowship and say, I'm the be all end all. You know, I can do it all. I can do everything. I'm great. You know, don't do that. Become that person that can self-evaluate, recognize where your weaknesses are, and seek those opportunities to improve them. That is one of the key factors that you'll find in any great leader is the ability to self-evaluate and then seek the opportunities to improve. So keep that in mind. Okay, Benson, did we have anything else?
All right, so that kind of ends, or we can open up the Q&A session now. If anyone has any questions, they can go ahead and ask. You can either maybe raise your hand or
Mega has her hand up. So does Femi.
Mega, you can go ahead.
So my question, maybe Dr. Tyson, you could help me out here, or the fellow panelists, is I've already done an internship previously, but I'm currently looking to do another internship, as I guess that kind of counted more towards my undergraduate degree. So what are some key facts or pointers I should look out while applying for these internships? I know some of them, the deadlines have passed. Some I did get, well, you didn't get selected, those kind of notes. But to be optimistic and look forward for other opportunities, what are some key factors maybe that could assist students?
I'll go ahead and take that one. I think, kind of as Dr. Tyson talked about at the very beginning, we already know that as an intern, you don't have as much experience, as much work experience. And so that's the value proposition for you, is that you're trying to get that experience through this internship, And so one thing that I really keep in mind, aside from that, when selecting the interns, is the opportunity for growth. The opportunity for growth. And what I mean by that is, do they exhibit ways in which they're willing to learn? Do they want to grow? Do they want to, really take advantage of an opportunity that I can give them in an internship and learn as much as they can, network as much as they can, really take advantage of it to where it'll help them, go to the next step of their career. Another thing that I really like to look at is, the initiative. The student really has to take initiative. And so, prime example, when we, all gathered at the ACHE local conference, I, was already kind of scouting out who I was going to hire and take on for my next cohort of interns. And so I saw this one undergraduate, go up to my CEO, shake hands with him, and introduce himself, and kind of introduce himself as a prospective candidate for the internship. And that's kind of what really stood out to me the most. And I personally took him on as my own intern. And so it's initiatives like that, and it doesn't have to be as big as going up to the CEO and shaking their hand. I know that can be very nerve-wracking, but taking different kinds of initiatives to even make yourself stand out. I think that's another thing that I would add to that.
You can ask your question.
Okay, hi everybody. Mine is more of a comment. My name is Femi Ayadi. I'm the faculty member at the University of Houston Clear Lake's Healthcare Administration program that's responsible for internships. I see some of my students here. I apologize for coming in late. I had another meeting at the same time, but I wanted to kind of add to this conversation about fellowships. And one of the things I tell our students too is that not only is there less fellowships, there are more people than within Houston who are coming for the fellowships at the Texas Medical Center. So they're coming from Chicago, Yale, anywhere. But one of the key things you have at your disposal, though, is that you've been here, and you should talk to any of your alums who's managed to get into one of those fellowships. So the first place to start about a year out before the fellowship interview process is connecting with, even if they've been alums for 4 or 5 years, whatever, as long as they went to your school or somebody connecting with the current fellows or previous fellows who are from your own school and asking them, how did you go through the application process? What are some of the things that, they're looking for in interviews? And I know that for me, many of my alums, what they say when they're talking about students interviewing for fellowships, you need to be sure, you need to demonstrate that you really want to be at, Texas Children or MD Anderson or whatever, and you have to demonstrate that you're familiar with the organization. So we have an advantage over the people coming from out of town, believe it or not, because you're familiar with this organizations a little bit better. But use the process of those alums who've got, like Bianca was saying, who've done the fellowships, and ask them way ahead of time. It really takes a long time to, and don't apply to 20. I'm not of the camp that says apply to 40 different administrative fellowships. I feel like apply to 7 to 10, because then you can spend more time on those applications demonstrating. And with internships, that's the way to go. There are more internships than we realize. Even we think we don't have a lot, but some students, talking about initiatives, go out there and find the internships on their own to fit. Some people will say, I work full time. How am I going to have time for an internship? Well, do it on the weekend at the emergency room, or figure out a way to just do something different so that you can, kind of learn something different from what you're doing currently. Okay, that's it.
Thank you.
Does anyone have any more questions that they'd like to ask? All right. I guess we can go ahead and wrap up this panel discussion. Yeah.
All right. Well, thank you, everybody. Good luck in your careers and in looking for internships. There was Bianca, you reminded me of one thing I did want to say, and I wanted to point out. She was talking about demonstrating the value of the internship to people in her organization to get that program. Her first round, she was able to get them to approve to do 4. She had 4 interns the first time around. The second time around, she very much proved the value of that, because what did you have, 12 the second time around?
Yeah, so the first time around, we actually had 6 administrative interns, and then
6, okay.
yeah, and then now I am over 38 interns.
Oh my God. So
yeah.
Oh my God. Yeah. So they have obviously demonstrated their value to that organization. They must keep you very busy. All right. Thank you, everybody. I just wanted to point that out. Bye-bye.
Or
Thank you, everybody.
Manal, do you have a question?
Oh.
Yeah, I had a quick question. Hi, my name is Manal. I go to the University of Houston, and I am a full-time MBA student there. I have a background in healthcare, and so, all this information was really insightful. But if there was one takeaway, and this question is open to anybody for students like us looking for healthcare administrative internships, what would be your advice, like takeaway advice for today?
In my opinion,
for me, the biggest thing that I picked up, if you're really looking to go and get an internship, is the most important thing is to really put yourself out there, and then really put yourself out there, really apply internships, create your own internship. That's really the biggest thing that has really stuck out to me through this panel discussion.
Thank you so much.
I was going to say the same thing. Take that initiative. Go get an internship. Make it happen. You can
Yeah,
do
that's
it.
the first thing I learned when I started my MBA program was networking and just, the same thing. So I really appreciate it. Thank you. This was very helpful.
Even
you already
even
have
on
a
LinkedIn.
Oh, go ahead, Benson. Sorry.
I was saying, even on LinkedIn, if you see someone from an organization, just shoot them like a text, like,
Benson, you're breaking up.
they really show like your interest in that organization.
Right.
Or like I was gonna say, like, even like
caught
through
what you
LinkedIn,
were
like just
saying,
shoot a
though.
text through there, or if you see someone like in a network event.
Yeah, I think I caught what you were saying when you were breaking up, though, but thank you.
Yeah, I was just gonna say, you already have a cheat sheet with the panelists to who to reach out to first.
Oh yeah, I absolutely sent a request to each and every one of you on LinkedIn already. So while we were talking, honestly, thank you.
All right. Thank you, everybody.
All right. Have a good evening.
Thank
Thank you.
You too. Bye-bye.
Thank you.
Bye.